I grew up in Buffalo, New York, and seeing people struggling with one ailment or another, and I volunteered at Roswell Park Cancer Institute and really got a chance to see that the doctors were impacting the patients, and so I always felt that that would be my best chance to help people. My name's Ronald Parsons. I'm the Surgical Director of Kidney and Pancreas Transplantation at Penn Medicine. I focus on kidney and pancreas transplant surgery. I also do recoveries for liver transplant. I work with trainees, fellows, residents, and work with other faculty members. And all of us are geared towards helping patients get organ transplants and recover from dealing with issues related to end organ failure. I think patients naturally have plenty of questions and concerns as to whether or not transplant is right for them. And I like to take time to make sure they have full awareness of what the options are. We work closely to make sure they have a good family support and make sure they understand the commitment to taking the medications. And a lot of times it's really good education that I think helps the patients go on to have a successful outcome after transplant. Penn has a long history of working with patients with diabetes, and over the years also been working with patients who have chronic pancreatitis. And a number of these patients have chronic pain related to their pancreatitis, and rather than becoming fully diabetic, we often will recover the islets within that pancreas and do an Auto-Islet transplant. We've really established that as something that we do routinely. I think that is certainly something that's unique for our program amongst other transplant centers. I would like patients to know that I'm committed to them and their well-being. There is nothing out there that I want them to fear from a medical standpoint. We are going to do everything possible to try and get them better. There's always options and alternatives. Even if transplantation is not necessarily the best therapy, there's an opportunity and an alternative to care that we can seek no matter what.